Okay, so today we're going to be doing an assessment on auscultation of the abdomen. So when you do an assessment of the abdomen, you do four things. You inspect, then you do an inspection first, you auscultate, then you percuss, and then you palpate. So when you inspect the abdomen, you want to look for contour, which determines her nutritional status. You would look for symmetry. You would look for any hernias or any bulging that could indicate any kind of mass. You would look at the umbilicus and see if there's any bulging again, and that could determine ascites. You would look at the skin color, any jaundice, redness, any lesions, any rashes. Then you would go ahead and look at the pulsation and the movement. And then you would go ahead and look at the hair distribution, which can indicate some kind of hormone problem. And then you would look at the demeanor, if she's relaxed or if she's restless. So then for auscultation, what I'm going to go ahead and do is I would imagine that there are 4 quadrants, and I would start at the right lower quadrant and I would listen. And I should hear 5 to 30 sounds within a minute, and I would do that in each of the quadrants. And I should hear a high-pitched gurgling sound, and that would be a normal sound. If I don't hear anything for 1 minute, then I would proceed to listen to that same quadrant for at least 5 minutes to determine if I hear a sound. And then as you go ahead and chart, you would determine if it's normal hyperactive, which is more than 30 sounds in a minute, or hypoactive, which is less than 5 sounds in a minute. And then the next thing I'm going to do is listen to the aortic, the renal, the iliac, and femoral arteries. And I would do that with the bell of my stethoscope because I want to determine if there's any kind of bruit. So I'll do that, and the aortic is just below the xiphoid process. And then I will go ahead and listen to the renal, which are a little to the side on both the right and left sides of her abdomen. And then I would listen to the iliac, which is below her umbilicus on the right and left sides. And then the femoral arteries, and that's below the iliac on both right and left sides. And I would be listening for bruits, and that could indicate hypertension. And it's normal to not hear any sound. And then I would go ahead and I want to determine a peritoneal friction rub, and I would do that by locating on her right side at the end of her rib cage where her liver is located. And I would listen for a friction rub. I would put my diaphragm over her liver area, and if there is a friction rub, it can indicate an abscess or a tumor. And then for a peritoneal friction rub on the left side of her ribs, just below her rib cage where her spleen is, if I place my diaphragm there and I hear a friction rub, that can indicate an abscess, an infection, or a tumor as well. And that concludes the assessment of the abdomen by auscultation. Thank you.